Okay, so post-op visit number 1, great case. Patient reached out to us here at Doctors of Podiatry. Dr. Wagner, I'd like to make my feet a little bit slimmer, thinner, maybe. Patient was not really happy with the appearance of her foot. It was very, very wide on the sides of both feet. Caesar will definitely attach the before pictures. A lot of what we call adipose fatty tissue, kind of like bulging out, right? And we wanted to make the both feet prettier. So without further ado, let's present the case. Okay, so the first thing that we're going to do, Caesar, let's talk a little bit about the left big toe and both toes as well. So the patient also presented with the left great toe, this one right here, was slightly longer than the one on the right. So the patient requested that we shorten the toe a little bit to match the appearance of the right one. And the way that we do this is through a minimally invasive approach. It's a keyhole little incision right here, one little suture there, and we're able to accomplish that. No pin screws or plates here. We're going to be implementing these very, very excuse me, we're going to be implementing these very, very delicate and intricate splinting techniques, taping techniques as well for the next several weeks. In addition, the patient at Doctors of Podiatry, we like to show the good, the bad, the ugly, and the real ugly. I think it's important for people to simply understand the intricacies of thinning, right, slenderizing these feet. So you guys will definitely be able to compare the after, what we see here, as well as the before, which Caesar is going to do us a favor and upload those as well. So in order to basically remove this fat, it's essentially a tummy tuck for the feet. The only way to excise, to remove this fatty tissue, is by excising skin. Okay? If I could, I would perform a lipoaspiration, liposuction, but that's not something that we can actually do on this part of the foot. Okay, so let's take a look here on the side. So this is the only, I'm not going to say the only negative part of this procedure, but because we do everything using our minimally invasive techniques, this is really the only procedures, right, in respect to the excision of the adipose tissue. You see this incision here on the side. Okay, so to elaborate more on this incision, the bulge was essentially right out to here. It went like this. So we were able to excise that skin and the underlying fat and then close it. And that's where everyone sees now that straight, really nice appearance on the side of the foot. The foot went from this to now this. And this is when I put a little bit of weight right here, it doesn't pop out in lay terms, right? And the same thing goes to the right one. We see this here, right? Nice and straight. And then Caesar there, okay? So this is again 2 days after the procedures, okay? And we went ahead, let's just go ahead and add a little bit to this. Right over here, there was also a little collection of adipose tissue, fatty tissue. So there we performed a toe tuck, left and right, both. A lot of people come here for the thinning of feet, thinning of toes. Would you like to say anything in respect to the clinical presentation? What your thoughts before, after?
I'm definitely very happy with the after surgery. I think pain tolerance was only bad for about the first day. Other than that, it's been normal. It's tolerable for sure. And the healing process has been okay.
Super. And we'll keep this one brief. How did the clinical presentation before affect you? What basically led you to make this decision to have the surgery?
The before and after photos that were on your page.
But for you, looking at your feet, what didn't you sort of like?
Oh, how the outsides were so wide.
Right.
Yeah, for sure. And just how my my bigger toes were just very fatty.
Okay. So, a lot of people battle these problems, and that's why we're here to provide alternative treatments. Long-term solutions is really, really important. But Dr. Wagner, so what happens now? The patient will go back home. The recovery is about 3-4 weeks in respect to the healing of these incisions. The incisions, with time, everyone does heal differently. So in respect to the appearance of the incision itself, we try to minimize any scarring, which is really, really important. So we focus our efforts on scar management during the course of the next several months. Stay out of the sun, to name only one very important one. But with time, they will definitely let you know. And that's what I tell people when they question us about this procedure. We ask them. It's a very, very simple question. What would you rather have? Would you rather have, the scar on the side of the foot, or keep the fat, which doesn't look great? And we let the patients make that informed decision. Okay. So again, great case, a lot of great reasons. A lot of people have asked us, to please upload a video as such to show the good, the bad, the ugly, and the real ugly. So this is 2 days post-op, but the patient is already ambulating, walking, and there's minimal discomfort, as you guys heard. If you guys have any questions, please feel free to ask away. We're very, very receptive to any questions, and we will definitely try to get to every single one of them. As always, thank you for watching.